Dr. Guleria, thank you very much for your time here on Mirror Now. COVID is not over yet. We are getting a rude reminder once again from China. But can I first come to you with a question that is plaguing the minds of all Indians? What is this new sub-variant of Omicron that we are talking about? Because 4 cases have now been detected in India. Is there reason enough for us to at least start panicking? Thoda sa.
So I think this new variant, which you said rightly said BA.7, has been there for quite some time, and it has sort of replaced the older variants. It has been seen in India also, but I think our situation is different from that as far as China is concerned. This variant we know has the ability to cause spread more rapidly, and also it has the ability to have what we call immune escape mechanism. So these two things are making it spread rapidly in China. That is that it spreads, it's more infectious, and it is also getting people who have already had COVID or have had the vaccine are getting the infection. But our situation is different from that as far as China is concerned, because our vaccination rates are high. And like you rightly said, I would encourage all those who have not taken the booster dose to come forward and take the booster dose. But we have good immunity both because of vaccination and because of natural infection. China didn't have that. They had a zero COVID policy. And because of the zero COVID policy, a large part of the population, especially the older age group population, is still vulnerable. They have not been exposed to the infection either because of natural route or through vaccination. The vaccination uptake in the older age group is very low in China. And we don't know about the efficacy of the vaccine because it's the local vaccine which has not been evaluated at the international level. Because of that, I think it's important for us to understand that we have good amount of immunity. And what we're seeing B.7 is that although it is more infectious, it is causing more disease. It's not causing severe disease. It's not causing more hospitalization, and it's not causing more death in that group of people who have got vaccinated or who have had past infection, because the immunity in them is able to really prevent the infection from spreading and causing severe disease. But having said that, we need to be vigilant. We need to have COVID appropriate behavior. We need to push for vaccination. And I would say that all those who have COVID-like symptoms should get themselves tested using RT-PCR, because genome sequencing cannot be done by the rapid antigen test. So get your RT-PCR test done, and genome sequencing should be done. We should also have surveillance in hospitals. Is there a surge in admission in hospitals because of COVID or because of influenza-like illness? We need to evaluate that, and that type of surveillance needs to be done along with genome sequencing.
Dr. Guleria, can I ask you what you mean when you say, please get yourself tested if you have COVID-like symptoms? I ask you this question because COVID-like symptoms are much like flu-like symptoms.
Correct. So that is very true, because currently a lot of people have flu-like symptoms and they say this is just a common flu. But the flu-like symptoms and COVID symptoms are the same. But in the current situation that we are in, it's important that if you have fever, which is going on for 2-3 days, if you have cold, cough, and body aches, then if you can, you should come forward and get yourself tested. Our testing is low right now. People are not coming forward and getting tested because they feel that the pandemic is over. This is just a seasonal cold and cough that we have. We don't need to get tested. Many of them, if they get tested, they turn out to have COVID, but it's a mild illness. But our concern is that in case it is a new variant, then we will not be able to pick it up, because unless you get tested and you do genome sequences, we will not know what is happening. So the solution is to ask people to come forward to get themselves tested. And the second is to do surveillance from hospital point of view. Because even if it's a mild illness, we still are comfortable. But if it's a more severe illness leading to hospitalization and people coming into the hospital, we must pick that up early so that we can take action. But currently, whatever data we have suggests that in the vaccinated population or those who've had past infection, the B.7 is usually not causing that severe infection.
Dr. Guleria, then from a citizen's point of view, this is the question I will ask. I have flu-like symptoms. I have COVID-like symptoms. In the last 2 years, I know exactly, 2 years ago, we were all mortally scared of getting COVID. Now we know what to do. We know that we need to isolate ourselves. We know that we don't need those 100 steroids and device. All we need is paracetamol, that too if you have fever, right? Now, if I know the protocol already, why can I, as a citizen, even if I think I have COVID, not just lock myself in my room, isolate myself, take my paracetamols, get better in 5, 6 days and resume my work? Why should I go through the pain of getting tested, sir?
Good question, because it has two parts. One is my responsibility for as an individual, and my responsibility for the nation or for my fellow citizens. As an individual, you're very right. You just isolate yourself. You take your paracetamol, keep yourself well hydrated. You can take your multivitamins, and by and large, you will become all right. We are not seeing a lot of people having severe illness, fall in saturation that we were seeing in the past. But from the society point of view, it's important for us to know what is happening in our country. If you have COVID, which is the variant that is causing it, and is it some new thing that is happening, and should we be vigilant about that? So that is why I'm saying that as a responsible citizen, it may be worthwhile to get your RT-PCR test done. It's not going to change your treatment strategy. It's not going to make a big difference in terms of what you're going to do. And we are not in a situation where you will be picked up by the authorities and put in a COVID care center or put in the hospital. You will just have to do what you rightly said, isolate yourself, take your symptomatic treatment. You don't have to take steroids or remdesivir or any new drug, and you will become all right. But I think it's important that we also become responsible, because if we don't get ourselves tested, how will we know if a new variant has entered into our country? Because we won't have enough tests to be able to do genome sequencing. So people coming forward is one area, and the other is hospitals have to be vigilant and should take samples of all patients who get admitted with flu-like symptoms or who are sick and could have serious infection which mimics COVID. That testing should be done. But that, I think, is also very important.
So you're saying get tested in national interest. It may not, it may not alter your treatment protocol, but do it in national interest. So I would recommend what Dr. Guleria is saying. Sometimes, you do things for yourself, and sometimes you do things for your country. This is the time to do things for your country and get tested. Dr. Guleria, then, my next question to you is this. You and other doctors have argued that our immunity is pretty good. Almost everyone in this country has got COVID. And why do I say that? I don't know what the latest government statistics say, but I know that every family I know has been infected with COVID. Almost everyone, almost every member. So that means that most of us, 99.9% of us, already have that immunity from the infection. Secondly, most of us have also now got our double dose, 2 doses. I know many haven't got their booster doses, but at least 2 doses we have. Does this mean that we have herd immunity? Will this constitute herd immunity? And if it does, are we all safe? Are we safe? Are we going to be fine irrespective of what happens in China?
Immunity is an interesting concept because it depends on what is the circulating virus. Yes, as far as COVID is concerned and the circulating virus is concerned, I think we have herd immunity because, like you rightly said, most of us, either with symptoms, without symptoms, with mild symptoms, have had COVID, and a large number of us have had it with the Omicron variant because that was very widely spreading in the last 1 year. So yes, we have had herd immunity. We have had herd immunity to some extent to the circulating Omicron lineages which is there in our country. But suppose a new variant comes where the variant is very different, and therefore that will affect the whole concept of herd immunity. So we have herd immunity to the circulating strain, but a new strain will need new degree of protection, and we may not have herd immunity because immunity will wane over a period of time, and the variant may also change with time. So we could say that yes, we have herd immunity to the circulating strain, but this may change with time, and that is why we keep on getting infection with flu or with flu-like symptoms every year, despite almost many of or large population getting it flu every year. So that concept will happen because the virus keeps changing. It has what we call an antigenic drift. It will keep on mutating and will obviously try and escape that so-called herd immunity.
But if that is the case, and if the virus keeps changing, what is the guarantee that the vaccine or the booster shot that we go for will protect us? Because that, the vaccine was made for a particular kind of variant, and we know that COVID over the last 2 years has mutated to an extent where I think it's almost unrecognizable now, sir.
So that's true, and that is what we do with the influenza vaccine. Also, every year we take the flu shot, which is of a different strain, depending on the circulating strain. And in the West now, we have a bivalent vaccine for COVID, which is available, which covers the older Wuhan strain and also covers the Omicron strain. So as we move